Stop letting society tell you about the best skincare routines, the hottest plastic surgeons, or the cream that will keep your skin from aging. It's time we start asking ourselves, what the fuck is beauty anyway? If we remove all the IG filters, is there more to a beautiful face than just skincare? Well, I'm here to share it with you, and hell yeah, there is. My name is Jen Carrasco. I have been an esthetician, as well as a high-level fitness competitor, and an all-around badass for over a decade. And I need you to know there is way more to keeping your mind and body clean than just a cream. Join me each week as I cut the BS out of getting healthy, caring for ourselves, and caring for our skin. I share real tips, real ingredients, and real experience. Now let's get some answers on what the fuck is beauty anyway. Welcome back, guys. So today we are going to talk a little bit about chemical peels. So I just kind of want to give a rundown really quick. I have been out and about. I went to the Arete in Idaho, had a fabulous time. I am going to do a little podcast so you guys know what the Arete is and what it stands for and what it represents and my beliefs with it. But I also am starting my 75 Hard, which is pretty cool. 75 Hard is with my First Form company that I actually work with. They are doing a workout. So 75 Hard is more of a mental challenge. So it's great for people to kind of get out of their comfort zone and plan their days and give them their mental focus and mental challenge. 75 Hard is 45-minute workout outside, 45-minute workout inside. Could be whatever you want it to be. It's also about drinking a gallon of water, not doing any alcohol, and maintaining a diet for 75 days, reading 10 pages of a book a day as well. It's great. You guys should go check it out. It could be something that you would be thoroughly interested in doing. It's a great kickstart to just any mental clarity that there is out there. So I have been, since I got back from the Arete, I have been waking up every morning and meditating for about a good 20 to 30 minutes. I put my phone away, I put my computer away, I go for my 45-minute walk, then I come home, I take care of some business, then I get ready and I head on into the office for the day, depending if I'm in the Vacaville or the Davis office, or if I am working on my YouTubes or social media for the day. So today you have me inside my home with Mr. Duke Diggler, so if you hear the dog barking in the background. But today I really wanted to go over chemical peels. So we're going to have a variation going on each week of different things. I have some great people coming aboard. So we're not necessarily just going to do basic skincare every week. We're going to integrate a lot of different things in there as well. But today I really wanted to go over chemical peels. I got a lot of people asking me questions, especially a lot of my patients that don't know the ins and outs of chemical peels. And I see a lot of them coming into my office and they're like, well, just peel my face. I want it peeled. Or I get a lot of people that have darker pigmentation that come in and they want peels. And you can't do that on everybody. So it depends on the skin type and it depends on the variation of your pigment or your acne or what's going on underneath. So my recommendation for a lot of you, because I get a lot of clients that are, well, I'm just going to order something online, or I'm going to go to Walmart, or I'm going to go to Target. And the thing is that when you're dealing with skincare and you're dealing with peels, you really need to do your research. And honestly, you need to go see a professional, because there's so many people out there that I see in particular that come into my office that have had treatments that they do at home and they fucked their skin up. Like, there's literally damage, and damage that I cannot control, versus hypopigmentation, which is, your cells lose pigment and you have white spots. So honestly, if you want to invest in your skin, you need to invest the right way. Don't invest in skincare that is not going to give you results. You need to really invest with people that you trust and that want your best interest at heart when it comes to your skin. So I have a list of everything. So if you hear papers flying, it's because I wrote down my checklist of what I want to go through today. So today we are going to just give you the nitty gritty of different peels and the variations and what they do for your skin. So as far as chemical peels, they're broadly defined as they damage the skin, meaning they burn the tissues of the skin. So chemical peels are broadly defined by the depth and damage in the skin that they produce. So they are categorized under a lunchtime peel, like a superficial or a medium, a depth that doesn't damage the epidermis skin below. So most superficial skin layers, medium peels may reach to the superficial layers of the dermis. The dermis layer of the skin is generally reached, I would say, more with your medium type peels. When you want to get more aggressive with those peels, a lot of times you would go into a plastic surgeon's office like my one in Davis, and we would numb you and we'd go a little bit deeper. So you just want to be careful. Those are the peels that you do not want to do at your home. Now, if they're superficial peels like fruit acids, things like that, those are really simple. But today we're actually going to go through actually aggressive peels. So the depth of the damage depends on the nature and concentration of the chemical of the peeling solution and the length of time they are permitted to interact with the skin. So you want to be careful with doing a peel, because the minute it hits your skin, you can't control it. It goes as deep as it wants to. It kind of has a mind of its own. There's no controlling that peel whatsoever when it hits your skin. So the popular chemical peels that are out there right now are like retinols, tretinols. It dissolved in propylene glycol. So it dissolves the acid barrier on the skin. I should say it more dissolves like the sebum, the superficial surface. So your skin is held by like glue-like substance that holds these tissues together. And what it does is it goes in and just kind of like disintegrates and melts those in a way and kind of eats them up. And then you get that flaking peeling of the fresh new skin that comes out. So there's alpha hydroxy acids, lactic acids, glycolic acids, beta hydroxy acids, salicylic acids, phenol, which is more of like your carbolic acid, which you would get more from the plastic surgeon's office. So today we are gonna basically go over your basic peels that you would get more in an esthetician office or a plastic surgeon or a medi esthetician or a master esthetician that works in a plastic surgeon's office. So what is a chemical peel? So a chemical peel involves the application of a toxic chemical solution to the skin in a controlled manner, producing controlled tissue death. The desired depth of the wound is dependent upon the condition to be treated. So after the peel, the skin regenerates. The damaged skin regenerates from the deeper layers of the epidermis and from the superficial dermis. So let's go over what you do to prepare for a chemical peel first. So often suggested, I always tell my patients when we're dealing with a tretinool cream, period, that people with cold sores or anything like that should definitely start the Zovirax 1 week prior to any treatments. I usually suggest that they start that anyway before we go into the peels, because it will help to not produce those cold sores to be happening. All patients, we should be wearing a high sunscreen prior and after the peeling. And those with darker skin may also require a pre-treatment with some type of, like, I don't use hydroquinone in my office, but I will use a different type just to kind of get their skin used to going into the skincare or the peels. So what should you expect from a chemical peel? So I always start my clients off with a series of chemical peels, because with a chemical peel, you want to make sure that you start less aggressive to more aggressive. You do not want to start at a higher aggressive peel because you want to slowly acclimate your skin to it. So for the best results, I do anywhere from a 3 to 6 peel treatment. Always recommend a series, and I usually do them every week apart apart to every 2 weeks, depending on your skin type. So depending on the skin type of peel, you may notice a mild tingling sensation. You might feel heat on the skin, some acids or neutralized, but we will definitely neutralize the acids if it gets too much on the skin, but it will keep working over time. By the second or third day, you'll notice peeling, flaking around the mouth, and then the forehead. If you keep your skin well hydrated, it will continue to peel for 7 to 10 days. So let's go over what you should avoid. It is important that you don't generate any additional heat during the first 48 hours of your peel because the layers of your skin have just been exfoliated off. They're completely exposed to anything like sun, radiation. Exposing a fresh new layer of your skin will be more susceptible to burning. Avoid exercise and hot baths. Whenever you leave the house, no matter what, and you're getting into the car, you should also put on your sunscreen. Sunscreen is huge at this point. You should also avoid the use of harsh exfoliants, acid cleansers, benzoyl peroxide, salicylic acids for 2 weeks after your treatment. Avoid topical medications. Also, like different gels, anything that's for acne or exfoliants that the doctors may give you or your plastic surgeon or dermatologist for about 10 days following your treatment. As skin begins to flake and peel, we do not want you to pull off the scabs. We do not want you to exfoliate them because you can actually cause a lot of harm to your skin. Your skin is regenerating itself. It's making fresh new cells coming up and turning that over. So unfortunately, you're going to have to go through the peeling process. So there are a lot of do-it-yourself chemical peels on the market, but it's always a good idea to be with a trained professional. I highly, highly suggest that you do not do this on your own. You will definitely regret it unless your doctor, your physician, or your dermatologist or plastic surgeon is giving you a home care to do at home that you can do. So let's start in with the chemical peels. So the first peel we're going to go over is a glycolic acid. A glycolic acid is considered more of your lunchtime peel because it is more superficial and a tendency for people to be like the first intro to your peel. So glycolic acid is an alpha hydroxy, which is short for, well, a lot of people say an AHA is what they say on there, but it's an alpha hydroxy acid. The name refers to its chemical makeup. So products feature this active ingredient come in many different forms. It can come in your cleansers, your serums, your moisturizer, your eye creams, facial peels, just to name a few. So a little bit about glycolic acid. It is a small molecule structure, so giving its ability to travel deep into the layers of the skin. Once there, the acid dissolves the excess sebum. Now, sebum is your oil. So your pore is filled. A lot of times you see the blackhead. The blackhead is the oil that's been oxygenated. So that's where the sebum, or what the sebum is. So once there, the acid dissolves the excess sebum and dead skin cells, revealing smoother, brighter, and younger looking skin. Lactic acid, on the other hand, has a larger molecule structure, which we'll go over the lactic in a little bit. So that's a little base on the intro of glycolic acid. So the benefits of glycolic acid are kind of endless. Along with they produce your collagen production or help stimulate them, along with diminishing the appearance of fine lines and wrinkles over time. It takes a while for glycolic acid depending on the percentage that you're using. It's much more than just an anti-aging product though. So glycolic acid also lightens discolorations such as sun damage, age spots. It even helps skin with prone to blackheads, whiteheads, and acne by keeping pores clear of old skin cells and tend to clog them, causing problems. A lot of my patients that tend to have a little bit more oily skin, active skin, prone to breakouts, I usually recommend them to be on an alpha hydroxy cleanser, probably on an everyday to every other day basis. So with that, it's leaving the skin looking refreshed, bright, and refined. So again, it all stems from its molecule size. That glycolic acid is the smallest of the acids used in skincare. That's why it's able to penetrate so deeply and exfoliate so thoroughly. If used correctly and you care for your skin correctly after the peel, it's a total miracle worker for lending an effortlessly dewy radiance, and usually seems to be exclusive to skincare experts and top models. So a lot of times I put my clients on this at a low level just for home maintenance. So we also do the clinical fire and ice treatment. That is a glycolic based. It's mixed with a couple other things. So that is like a great lunchtime facial to come in just to get renewed, or something right before an event. Your skin looks fabulous. I mean, you can get it that morning and go out and your skin looks phenomenal for an event. So let's go to the next acid. So let's get into salicylic acid. First off, let's establish what salicylic acid is. So it's a little more complicated, but the exact structure of salicylic acid is important in explaining and why it works so well. When it comes to skincare products, there are two classes of acids. You'll see often beta hydroxy acids and alpha hydroxy acid. Salicylic acid is a beta hydroxy acid. So meaning the hydroxy part of the molecule is separated from the acid part by 2 carbon atoms, as opposed to alpha hydroxy acids where they're separated by 1 carbon atom. Anywho, salicylic acid is actually derived from willow bark. Willow bark is fabulous. I have it in a lot of my hyperpigmentation products for my clients or patients. So with the structure, it is important because it makes salicylic acid more oil soluble, so it can penetrate into the pores of the skin. Both alpha hydroxy and beta hydroxy acids exfoliate the skin, but alpha hydroxy acids are more water soluble, where beta hydroxy acids are oil soluble. So generally, oil-soluble ingredients penetrate through the lipid layers between the cells more readily. In other words, oil-soluble ingredients can penetrate the skin at a deeper level with their water-soluble counterparts. So what does salicylic acid do for your skin? Anywho, especially for blackheads and whiteheads, this is huge. This quality is precisely what makes salicylic acid so potent ingredient for targeting the acne clients. 1, it penetrates the skin. Salicylic acid dissolves skin debris that clogs pores, acts as an anti-inflammatory, and also helps with red inflamed pimples and pustules to go away faster. So with a lot of my patients, I will do in-office procedures with salicylic to go a little bit deeper, and I will send them home with a protocol to use with a light salicylic acid during the weeks before I see them again. Or I will start them off on a series of salicylic and then send them home. And I mean, the results are phenomenal. So let's go into what salicylic acid is actually doing. So breaking down, the skin cells also promote exfoliation. Salicylic acid is considered, I say, a medication, which means that it's perfect for supreme exfoliation. So it's more of the keratin on the skin. It just like breaks that down. Salicylic acid is also breaks apart the attachments between the cells of the outer layer, which is exfoliating of the skin and clogging the pores. Therefore, the best acne treatment, I believe, is salicylic acid. It helps with the blackheads and whiteheads. Salicylic acid can directly dissolve the keratin plugs in regulating the skin cells, like I explained before. So it really helps, I think, the effectiveness of cystic acne due to its antibacterial effect, but less so than the classic blackheads and whiteheads. So there is an alternative, meaning that you can overuse the salicylic acid, so you do have to be careful. So that's why I always say see a master esthetician, plastic surgeon, or dermatologist. So who should avoid using salicylic acid? You can actually use too much salicylic acid, which can be a problem. The primary negative effect of salicylic acid is its ability to irritate and dry the skin out and make it more sensitive for those who actually overuse it. So depending on the concentration and the number of applications, some people may experience dryness, peeling, redness, and some skin irritation. For this reason, those with skin that already severely dry or sensitive should consider avoiding a salicylic acid altogether. It's also not the best choice if you are pregnant or taking certain medications, including blood thinners. Applying salicylic acid or salicylic to very large portions of your body can lead to salicylic poisoning. So just don't apply a layer of it all over. Stick to only acne-prone areas. So I highly recommend that. So let's reach out and go to the next acid. The next one I'm going to go over is a mandelic acid. A mandelic acid is an alpha hydroxy acid. So remember what we just talked about with the alpha hydroxy and the beta hydroxy acid. The mandelic is derived from bitter almonds, so it is way more gentle for the skin. Let's talk about the benefits of mandelic acid. So mandelic acid is better for wrinkles, fine lines. It's more of your go-to anti-aging ingredient in the world of skincare. So it works to accelerate cell turnover by dissolving the tiny bonds that hold skin cells together, helping to remove dead skin on the surface that can lead to dull complexions as well as fine lines. It also strengthens collagen, one of the building blocks of skin supports network that gives you its more youthful firmness. So let's talk about the hyperpigmentation and discoloration with this. Melasma is a most common skin condition in which light to dark brown or grayish pigmentation develops on the skin. It's almost like you see people that have that pregnancy mask on their skin. So mandelic acid has been shown to reduce melasma by as much as 50% in 4 weeks, resulting in a more even colored complexion. So again, it does help with acne. Mandelic acid is an antibacterial properties that are extremely helpful in treating acne. It also helps to regulate sebum production and turn to decrease the occurrence of breakouts. Mandelic acid has even been shown to benefit those who suffer from cystic acne. So like I say again, it's nice to see a physician, a master esthetician, because they can really penetrate if they feel like your skin is a little bit more sensitive and maybe they want to start with a mandelic versus a salicylic. So that's kind of the regime that, it's something that you're not educated enough to know which way you want to go as far as a peel goes. So like I said about the mandelic acid, it's definitely a little bit more lightweight. So there's some research showing that mandelic acid is an effective exfoliant, although it's not as effective as like your glycolic acids due to its larger size molecule. So when it's a larger size molecule, it can't penetrate as fast. So it has a slower penetration into the skin. However, these traits can also make up mandelic acid more tolerable for those with sensitive skin. So like I said, unlike glycolic acid, mandelic acid is a light sensitive, must be packaged in a different container than a glycolic so it remains effective. A couple studies show that mandelic acid and salicylic acid work well together in a high-strength peel for those people with darker skin tones, struggling with discoloration, including the post-acne marks. However, what we don't know is how well mandelic acid would have worked on its own. So it's possible that results will more from salicylic acid than the combination of the two acids together. Also, on another topic with it, other research has also shown that mandelic acid can increase the sebum oil production, which isn't great for oily skin. So it depends again if your skin's a little bit more of like the drier sensitive type that produces the oil versus overly acne. So we wouldn't necessarily push it for your acne clients, but it may really, really benefit more of the drier skin types. So that's a little gist about the mandelic acid. I don't do a huge amount of mandelic acid in my places of business. I tend to go more for the aggressive, but I will do a mandelic on a client that I think is definitely more sensitive or extremely dry, because I don't want to dry that tissue of the skin out even more. So we're going to jump into the next one, which is lactic acid. So what is lactic acid? Lactic acid is a type of an alpha hydroxy acid, again, an AHA acid, that is found naturally in milk, fruits, vegetables, and other botanicals. So what does lactic acid do? Lactic acid is an exfoliant. It is generally recommended to improve acne, discoloration, and fine lines and wrinkles on sensitive, dry, and mature skin types that may be easily irritated by more aggressive acids in the group, along with increasing cell turnover and stimulating collagen production like its fellow acids. Lactic acid also ups the natural barrier lipids in the skin, which prevents water loss and helps hydrate your skin. So with going over that, this acid might be something that is extremely useful for you if you are more on the drier skin or your tissues don't hold the water and hydrate properly. So it's especially good for treating bumpy skin without extracting the dryness. So let's go ahead about the uses. So the uses with lactic acid is basically lactic acid helps to keep the skin moisturized and feeling less dry. When you use a lactic acid regularly, it can also improve signs of aging, stimulate collagen renewal, and firm your skin. Hyperpigmentation, which are sunspots or age spots, fade, and fine lines and wrinkles soften and smooth out. Again, depending on the potency of the lactic acid is how you get your results. Again, we always stay small and we work up. I always recommend to do a series of any peels that your master esthetician, your doctor, your plastic surgeon, anybody recommends. So let's talk about a TCA peel. I do actually a lot of these in my office. It's kind of my to-go peel. I tend to use this a lot depending on people's skin texture, or I will mix it with a couple different other peels that I do, or microdermabrasion or dermaplaning. So typically, a TCA peel is a light chemical peel. Many people don't relish the idea of the 2 weeks in hiding while waiting for their new skin. So less drastic types of peels were introduced about in the 1980s. So this procedure hurts when performed, but peels more superficially than when the phenol is used. So like again, when I explained in the beginning what the phenol is with different peels. So with the TCA, the epidermis and superficial dermis peel healing in about 5 to 8 days. The more superficial peel, the fewer wrinkles are removed. So the TCA concentrate ranges from 15% to 50%. Alone or in combination with a higher chemical. A lot of times I buffer my TCAs at first and I build you up over a period of time with it. So the TCA peel is useful for pigmentation, irregularities such as sun-damaged skin, discoloration from pregnancy. It helps with wrinkles and other sun damage. Acne and large pores are definitely improved. Even some pre-alignment conditions can be occurred with this. So moving forward, we're going to talk about TCA peels. TCA peels are actually what I prefer in my office a lot. I do it for a variation of clients. I think with TCA, it's nice because I can mix it with other peels and combinations with microderms, things like that. So TCA peels are pretty much a cosmetic treatment that exfoliate your skin again. It strengthens are alternate. So we usually start at a lower base and work your way up with the TCA peel. TCA peel, you tend to get more of like a frosting on the skin, and you do layers on a TCA peel. So usually you can go up to like a 5 layer at your extreme max of a TCA peel. So TCA peels are better for treating skin conditions like melasma and acne scarring. So there is TCA peel application process sometimes causes temporary side effects such as burning and discomfort. After the peel, you may experience redness, skin sensitivity, and in rare cases, there is a risk of scarring due to infection. So that's why I say always go to somebody who knows what they're doing, somebody who is educated in this. Finding a licensed and certified health practitioner or a master esthetician to do your peels. So the peel usually takes about 30 minutes to apply, and then you can go back to your normal activity after that. The costs for TCA peels are completely different, but they can be anywhere from $250 up to a $800 range on top of that. So it is the best thing I know for melasma. It is fabulous for melasma patients. Let's go over what a TCA peel is again. A TCA peel is a non-invasive skin treatment used to treat skin discoloration, scarring, and wrinkles. The peel gets their name from a long time ago of a long name of an acid, which is used to clear away dead skin cells to reveal the newer and smoother skin layers below. A TCA peel is a part of a group of a skin treatment called chemical peels, which I've been going over with the alpha hydroxy and beta hydroxy acids and the phenyl acids that go in there. So let's go into who is a good candidate for a TCA peel. Chemical peels can be superficial, medium, deep strength. TCA peels are considered medium strength. So meaning they should only be applied by a certified skin care professional. The ideal candidate for a TCA peel is a non-breastfeeding or pregnant woman, does not have skin conditions such as psoriasis, eczema, or rosacea, does not have a job that requires them to be outside because you will be more prone to sun damage, has no history of keloids or poor wound healing, will be consulted by a doctor, your esthetician. I always have them come in for a consultation before, and I actually will do a patch test with the TCA peel just to make sure that their skin does really good with it. And again, before any peel, you need to avoid a lot of the different, glycolics, retinols, anything before you come in for your procedure. The TCA peel, like I said, will take about 30 minutes. So I or whomever you have will instruct you to lie down, go over all of the things with the TCA. Most people feel a burning sensation for the first few minutes, plus a really pungent smell, followed by a stinging, a little bit of pain as the acid exfoliate clears away the top layer of your skin. The procedure is done in a single session. It may be recommended, which I highly recommend, to do a session of them. So if you're looking to achieve a certain result, multiple sessions may have to be required. It's advised that you wait several months between chemical peels to allow your skin to fully heal. So usually when we do a first peel, we'll have you wait, just a couple weeks to see how your skin repairs. After a TCA peel, you may notice some changes right away. It could also take 3 to 4 days before you see the full effects develop. After the initial redness phase from your skin, you'll notice that your skin begins to feel tight throughout the 3 next days. The affected area will shed the skin like freaking crazy, by the way, depending on how deep it goes. It's normal for the peeling skin to come off in patches over the course of several days. So avoid scratching your skin, peeling it off with your fingertips. After the skin comes off completely, the skin underneath may appear firmer, smoother, brighter, and more youthful. During the period that your skin is peeling, make sure to wear sunscreen and protect your skin from sun each day. Wash your face with a gentle cleanser to prevent stripping your skin additional moisture. We will also plan you a regime after, whomever you see, a regime after to at least keep your skin where it needs to be. So preparing for a TCA peel. Prior to a TCA peel, you may need to switch up your skincare regime. Your healthcare provider, your master esthetician, they should go over your skincare routine and regulate it so that way going forward, you're going to have a great peel and you're not going to have alter indications with your peel. So the last peel I'm going to go over today is going to be the Jessner peel. So the Jessner peel was formulated over hundreds of years ago. So what it does is it reduces dark patches and age spots, evens out the skin tone, reduces the appearance of scars, smooth fine lines and wrinkles, and it treats melasma as well as hyperpigmentation and acne scarring. So while many of the chemical peels cause lasting discoloration on darker skin, a recent small study found that a modified Jessner solution safely and effectively reduces melasma and pigmentation imperfections in darker skin. So the Jessner peel, I tend to do more for my darker pigmented or people that I notice will hyperpigment from things a lot easier. So especially people that hyperpigment very easy from scratches, scars, lasers, waxing, things like that, I tend to push into my Jessner peel. So it also has been shown to be effective in treatment of acne scars, even when used as a superficial peel. So how does the Jessner peel work? The Jessner peel works by removing the top layers of the skin to reveal smoother, more even toned skin. How deep it penetrates depends on what kind of chemical peel you get, superficial, medium, or deep. Like again, there's all the different stages of all the different peels. The Jessner peel is typically a medium peel as well, which means it removes the skin cells from the top layer of your skin, the epidermis, and the upper portion of the middle layer, which is the dermis. So, however, it also can be used as a superficial peel, which has a faster healing effect time, but needs to be performed more often to get more results of a deeper peel. So people that are scared about things or getting the peels or peeling, it's nice because you can definitely, with any of the peels, it's not just the Jessner, but you can do it at a lower level and just do it constantly and you'll get those results. It's just going to take more time. So regardless of the depth of the peel, it is made up of a mix of lactic acid, salicylic acid, and it's almost like a retinol type of 95% of the ethanol solution. Due to some of the concerns around the safety, there are also Jessner peel solutions made without the ethanol solution. So the Jessner solution is also frequently added to other peel solutions to increase their effectiveness on scar and pigmentation. So again, like I talked about some of the other peels, I may mix them up a bit depending on what my outcome is and what I want to address with my client. So I always do a tip for everybody with each podcast. So my tip for this podcast is going to be taking care of your skin after a peel. And a lot of times this is just taking care of your skin in general, I think, after any skincare treatment you do with your physician or esthetician or whomever you see for your skin routine. So I always say with taking care of your skin is definitely moisturizing it frequently if you're getting a peel. So let's go over your peel as far as taking care of your peel afterwards. So apply ice packs or use a fan to relieve the burning. Just be careful not to let the skin dry out in front of the fan too much because you'll get the cracking and the dryness. Moisturize frequently. Applying a moisturizer anytime your skin feels tight, dry, or itchy. You may need to apply moisturizer 10 to 20 times in a day just to moisture the balance of your skin type. Now, I am not telling you to go use an over-the-counter greasy moisturizer that's going to clog your skin type. So you definitely need to talk to your skincare guru, I should say, and they will go over what they think is best for your skin. So it might be like a gel, it might be balm, it could be any of those things. So Follow all aftercare instructions your doctor, physician, esthetician gives you, and definitely include a gentle cleansing and an antibiotic ointment if necessary. Do not pick, peel, or rub your skin. The peeling outer layer acts like a bandage and protects the skin from underneath. Removing this layer too soon can lead to burning, pain, and potential scarring. Hot water in the shower and sweating can also cause your skin to come off too soon. So please be cautious when you are really exercising. No swimming, no saunas. Use your best judgment. Take any medications your doctor prescribes, as well as if you need pain relievers, antibiotics, anything like that you need. Prevent sun exposure. The skin is especially sensitive to the sun after a peel. Completely avoid the sun until your skin is fully healed. And be careful to use proper sun protective clothing and sunscreen in the months following to prevent darker spots from developing and protect against any damaging sunburns. If you are bothered by redness, peeling of your skin, you can wear makeup to cover it once your skin is no longer irritated. A lot of times I recommend my clients to use the Jane Iredale because it's a really nice powder to go over, and it will definitely give you your sunscreen, and it will give you some great coverage on top of that. So the bottom line is, from treating acne to reducing the appearance of freckles, sun damage, dark spots, and scars, all of the peels that I said today will leave your skin smoother, more even toned, and you'll see benefits from at-home peels to you're more likely to get long-lasting from dermatological master esthetician treatments. So it's definitely important to talk about these, get fully well educated on all of them so you know what you're dealing with. And always DM me, follow me on my IG, send me an email. If you have questions about anything, I can answer. I've been doing this for over 20 years. And even to this day, it's a learning process. I'm still learning every day. So with this note, have a fabulous rest of your day or evening, wherever you're at. And stay tuned for the next podcast next week. And I will talk to you guys soon. Thanks for tuning in this week. I hope you feel more empowered and more inspired to love the skin you're in. As we navigate new society norms and beauty daily, make sure to always ask yourself, what the fuck is beauty to me? And know that's all that matters. If you love this content today, make sure to subscribe, rate, and review. Follow me and get more info on my guests at ViragoStudio.com. Yes, I said it, ViragoStudio.com. And that's the shit. See you on the next episode, beauties.